so maybe I can leave soon. Oh my goodness, another client coming in. Okay, looks like I'm gonna have to text my friends that I'm going to be late for our dinner plans because I have another patient coming in for a medical exam. Yeah, okay. Well, I'll just have the nurse send them on in, and let me just send some text messages that I'm going to be late because that's just sad. Okay, looks like I'm going to be late because another client arrived to the clinic. Yeah, and it looks like reading their chart here that they have something going on with their stomach and a bit of a headache. Yeah, okay, too much information, honestly. And, oh, hi there, I didn't even see you. How long have you been standing there for? Nearly the entire time. Oh, I do apologize. Welcome to Dream City Clinic. I am Dr. Unprofessional. I did see on your chart here that your primary physician is not attending today. Yeah, it looks like your primary physician is just not here today, so you're gonna have to deal with me. Is that okay? Good. So again, I'm Dr. Unprofessional. It's a family name. I promise you that I am very, very, very professional at my work. I just got my degree. I am a brand new doctor. I got my degree on Zoom online, and it was only like 120 hours. It was like so easy. Honestly, being a doctor is like my passion, and I like love how cool it is. Yeah, so welcome. Take a seat right at the exam table there, okay? And I'm just gonna speed through this a little bit just because I do have plans after this because my friends are waiting for me. Yeah, do you like my shirt? Yeah, I literally have to go soon though, so like let's make sure that we get you taken care of before I skedaddle. Okay, good. So can I get your name? Beautiful name, by the way. And can I get your birthday? Yeah, and what zodiac does that make you? Yeah, I can tell by the attitude. Yeah, honestly. And I did see on your report that you have had a little bit of headache problem and your stomach has having some issues. Yeah, and what seem to be the issues if you want to go into like more of a detail? Yeah, just a bit of here and there. Yeah, and it also looks like you're tired. Is that normal? Because you do have some under eye baggage there. Yeah, you know, I'm actually going to quickly take care of that. Is that okay with you that I just take care of that really quickly? I just want to make you look a little bit more awake, you know, so I'm going to put a little bit of concealer under there. No, I promise you, this is just a part of the experience. Yeah, is it okay that I do that? Okay, I'm just going to put a little concealer there. Can you look up for me? Yeah, and then I'm just going to just pat that in, okay? And honestly, so much better already. Okay, good. So, I'm gonna get a one glove on. I did just get my nails done before I just get your vitals. If that's okay with you, I promise you my hands are sanitized and clean. Pinky promise. Good. And I'm just gonna get one glove on too because I literally have to keep my manicure looking good. So, how are you? Have you been doing a lot of work or perhaps school lately? Yeah, I can tell because you do look really tired. I'm actually going to give you this concealer that you can use it later. Yeah, no, trust me, you need it. Yeah. So what I'm going to do is I'm going to first get your vitals, and then we're going to move on to just a medical exam and a bit of a cranial nerve exam to make sure that you're doing well. Yeah, I learned that on my courses online. I'm kind of a professional. Yeah. So first I'm going to ask you, can you look at me again? Good. And is it possible for you to quickly just follow my finger? Yeah, could you follow my finger up? Could you look up and could you look down? Okay, that looks like that's okay. I'm first going to get your temperature, so sit still. I'm going to just scan on your forehead. And it looks like, I think that's normal temperature. What do you think? It does say that your temperature's a bit high. Is that normal? Yeah, it is actually a bit interesting in this clinic. I don't control the thermostat, but it does seem to be a bit higher than normal. Yeah, let's try that again though. Let's get your temperature. And yeah, now it seems to be low, but I think that's fine, right? Yeah. Have you had any signs of sickness in the past 2 weeks? Perhaps like fever, or perhaps you've been feeling a bit under the weather? Yeah, you know, that could just be due to the change in like seasons. first we're going to check your eyes, and then I do have a tongue depressor, and we're going to take a look inside your mouth, okay? So first I'm going to ask you, can you look at the light? And can you look over there? Good. It looks like your pupils are properly dilating and increasing and decreasing in size when I do show them the light. Okay, I'm going to ask you, can you look over there? Good. Look over there and look over here. Perfect. Okay, I'm not gonna lie to you. I did purchase this on Amazon. I actually purchased all of my tools on Amazon. Isn't it cute? Yeah, it looks like a doctor's office. It looks totally legitimate. No, I promise you I'm legitimate. Okay, and I'm going to just get up close really carefully. Do you wear glasses or contacts? And do you feel like your vision has changed in the past, like maybe like 2 weeks or a month or so, or has it been the same? I'm gonna write that down. Okay, so I'm gonna show you a very bright light. Again, a little bit of my methods are a bit unconventional, but this is to test how bright your eyes are able to see, like sensitivity and stuff. So let me know which light is brighter. Left or right? Great. And let's try this again. Which light is brighter, left or right? Great. And one more time, which light is brighter? Great, left or right? Perfect. Now what I'm going to do is I'm actually going to take a quick look deeper into your eyes. Can you look at my nose? Good. And is that pretty bright right there? Okay, let's test the other eye. Look at my nose. And is that pretty bright right there? Perfect. Okay, and what I'm going to ask you to do, again, a bit unconventional than the usual. I'm going to ask you to blink for me. Can you blink and close your eyes? And can you open your eyes? Can you close your eyes? And can you open your eyes? Yeah, it does seem like you're pretty tired. Are you okay? I'm going to write that down. How many hours of sleep do you get? Yeah, I can tell. I'm going to ask you, just for like your health, that you get better sleep. And your skin looked a bit dry. I'm not going to lie. It looked a bit like you're a bit dehydrated. How much water do you drink in a day? Oh my goodness, I can tell. So what you typically want to do is you want to drink half of your weight in water ounces. Okay, just making sure. Okay, what I'm going to do next is I'm actually going to take a deeper look into your eye, and we're going to do a bit of a focus test here, okay? So I do have my light shining on here. Can you do something for me and follow the light with your eyes, but don't move your neck or your chin at all to look at it. Just use your eyes. Good. So I want you to follow the light. Good. And don't get distracted by my gorgeous nails. Aren't they so gorgeous? Yeah. So don't get distracted by the light. Good. Just look directly at the light. Good. Looks like your eyes are working properly. What I'm going to do next is we're going to just take a look with a tongue depressor. And have you had any like sore throats recently? Or perhaps you've had any type of problems with your teeth? Okay, good. So first, can you smile for me? Let's look at your teeth. Okay, and how often do you brush and floss? We're gonna have to increase that because I just smelled some dragon breath. So just say maybe don't say just open your mouth a little bit. Good. And I'm just going to take a look. Okay, and actually that looks great. What I'm gonna do next, I'm gonna feel right here for your lymph nodes. I'm just gonna put pressure onto your chin if that's okay with you. Okay, good, and perfect. Do you feel any pressure or any signs of sensitivity when I do put pressure there next to your lymph nodes? Okay, very good. That's actually a good sign. At least I think that is. I'm gonna write that down. Yeah, the computer double checked. That was a good sign, so I'm gonna say that we're doing great here. Looks like your health is nearly flawless. What we're gonna do next is I'm gonna take your vitals. I'm gonna get your heart rate, okay? And what I'm going to do is I'm gonna put it next to your shoulders, and then we're going to feel the abdomen, and we're gonna listen to your stomach, okay? Good. So if it's okay with you, may I place this on your shoulders? Okay, and then may I place it on your abdomen afterwards? Perfect. So it might be freezing, and there's nothing I can do about it. It's just gonna be freezing cold, okay? So just sit and relax. Okay, I'm gonna put that right there and just breathe in and breathe out. And I can already hear your stomach working. If you do need to flatulate just a little bit because your stomach is going wild, maybe you didn't eat or something, you're allowed to. I won't laugh or anything, I promise you. Maybe, but I might text my friends about it later. Yeah, okay, so just relax, no worries. Breathe in and breathe out. side. Breathe in and breathe out. Very good. Okay, now I'm going to place this on the thorax. And I just want you to relax, breathe in, breathe out. Okay, just feel comfortable. Good. Okay, I think I have heard all that I need to hear from that. So, I do hear that your stomach is acting up a little bit. So, I'm going to ask you a couple questions about your diet, okay? And what do you eat? Really? No, I'm not shocked at all. So you're eating a lot of like fast food, a lot of processed foods. Do you just not have a lot of time to like make food on your own? Yeah, and could you tell me where you eat this food from? Oh, McDonald's, Taco Bell. Oh my goodness. Okay, Chick-fil-A. Okay, I'm just gonna write this down here. No judgment, but full judgment. I think I know why your stomach might be acting up a little bit. You are consuming little to no fiber in your day, which can upset your stomach dramatically. So what I'm going to do here is I'm going to write down that you need a lot of fiber into your diet. Yeah. Now just a bit of a detailed question here. It's just going to help me write down a proper care treatment for you, okay? When you do go to the restroom, yes, how often do you per week, or how often are you able to number two? Like once? Okay. No, I'm not writing anything down. Yeah, no wonder your stomach is going wild, like a little party down there. Kind of sounds like a witch's cauldron. Yeah, it also kind of sounds like your stomach's making Harry Potter, wizard, and like wizard spells. Yeah, like expecto patronum. That's what it sounds like down there. Yeah, I can tell. So, what I'm gonna do next is I'm going to just carefully test your focus and your eyes. We're gonna move on to the cranial nerve exam part, okay? Good. So, what I'm gonna ask you to do first, could you look at me? Good, I'm gonna just test how your muscle functions are. Can you raise your eyebrows for me? I'm gonna just touch your forehead right there, okay? Okay, and now can you furrow your brow? Amazing. Gonna just tap right there between your eyebrows. And relax. Can you raise your eyebrows as if you were very shocked? Amazing. Good, and relax. And can you close your eyes very tight? Perfect, marvelous. It looks great. Now relax. Good. Are you able to close one eye? And are you able to close the other? Okay, open both eyes. Close both eyes. Open both eyes. Close both eyes and open again. Do you feel like your eyes are getting tired? Yeah, I can tell. And it's literally just because you look like you need more rest and recovery in your life. And I don't think people know, but taking care of yourself and having self-care days is so important to making you feel like the best version of yourself. Exactly. I'm gonna write that down. And after this as well, I'm gonna give you a cute little llama sticker because you deserve it. Okay. And what I'm gonna write down here is I'm gonna actually ask you, can you relax your face again? Okay. Can you give me a very cheesy smile, kind of like a smile you'd see in a movie, like? Good. Okay. And can you frown for me? Perfect. Okay, now relax. Now I'm gonna put my hands right here next to your jaw, and can you clench your jaw? Good. 3, 2, 1. Perfect. And 3, 2, 1. Marvelous. Looks like you know how to keep your face functioning properly. And I'm gonna write that down because it's actually very important. Okay. And now I'm gonna just ask you, have you had any troubles with hearing in the past couple of weeks? Do you feel like when you listen to loud music, because you seem like the type that listens to loud music, you are wearing an anime t-shirt? Yeah, I can tell. And no judgment, but full judgment. Yeah, I can tell. So, do you feel like when you listen to loud music that sometimes it can make your head hurt a little bit? also, because your eyes are a bit irritated, do you spend a lot of time like on your phone and like reading things, and like you're constantly on like maybe social media or like playing video games? Yeah, I'm gonna ask you to do something for me. Can you put your hands like this in front of you like this? Good. So if you have like a little part in your finger like this, I'm actually gonna take a look at your fingers. I can tell right there that you hold your cell phone a lot, which is actually not good for you, and I can tell that you need to relax and get a lot of screen time out of your life. Yeah, I can tell. I'm writing that down. What social media do you use the most? TikTok or YouTube? YouTube, yeah, I can tell. Come on, back down. Thank you, let me know. And who's your favorite creator? Good answer, good answer, good answer. I'm actually gonna write that down. Good. So, what I'm gonna ask you to do now is, can you raise your shoulders for me, just like as if you were excited, or perhaps as if you were a little bit cold? Good, and I'm gonna ask you, I'm gonna try to push your shoulders down, but I want you to resist, okay? So raise your shoulders and resist me pushing down. 3, 2, 1, resist, resist. Flawless. You can relax them. Now I'm gonna ask you to do is, this is a hand test and a hand coordination test, okay? And I'm gonna ask you, can you raise your hand for me? Good, and I'm gonna push down on your hand and I want you to resist, okay? So raise your hand and resist in 3, 2, 1. Resist, resist. Perfect. And the other hand, raise your hand, 3, 2, 1, and resist, resist, resist. Perfect. So that is actually a super good test to see that your reflexes are working well and that your muscles are actually working in coordination to your spine and your body. Yeah. Again, I'm a professional, so just gonna let you know that. Now I'm gonna quickly test your ears, okay? And you did say that sounds make your ears a bit more sensitive. Is that true? Yeah, so what I'm going to do is I'm going to first take a look inside your ear, and I have this really interesting otoscope that's going to take photos. You're going to hear the photo take a snapshot, okay? I'm going to put a little protective cover over that I'm going to take photos inside your ears, okay? Yeah, and then I'm going to send them as a text message to you. Isn't that cool? Yeah, it's awesome. So what we're going to be doing is just taking a look inside your ear, getting documentation of it, and seeing if there's anything in your ear that could be causing you any problems, okay? Also, it can throw off your equilibrium, so let me know if that happens. Yeah, kind of like a boat. Yeah, when a boat goes back and forth, that's what happens with your ears. It's true. So relax. I'm just going to take a couple photos of this ear, okay? And just sit still. Okay. Flawless. Okay, and the other ear. Just relax. Okay, I'm gonna pull that up on my computer, and it does look like, I don't want to tell you too much information, but it does look like that your ears have a lot of natural earwax, which is good, but it looks like this could also be bothering your ears a little bit by throwing off your equilibrium. I'm going to just carefully clean that before we continue, okay? So I'm going to use a little tool here, and we're just going to carefully cleanse the ears, okay? Yeah, I promise you it's awesome. First, I'm going to use just a little bit of an ear cleansing oil, and we're just going to add 1 drop in each ear, okay? And first, I'm just going to tilt your hand a little bit, okay? So just sit still. Okay, I'm going to add 1 drop, okay? Perfect. I'm going to tilt the other direction, okay? I'm like, isn't this so cool? Absolutely professional. And a drop. Good. Now I'm just going to carefully just massage that into the ears. Can you look at me? Good. Are you feeling okay? Good, good, good. I'm going to carefully massage the ears now, okay? Perfect. And I'm not going to lie, I do have to speed this up a little bit, so I'm just going to carefully cleanse your ears, okay? Okay. And let's take a quick look inside your ears again, okay? Oh my gosh, it's like night and day, completely gorgeous inside your ears. Lovely. Honestly, fabulous. We love and we stan. Very good. So what happened was, I'm going to show you a model. Look at this. I got this on Amazon. Isn't it so cute? So this is your ear. And what we saw was that there was wax in your ear right there. And that's kind of unacceptable. Okay. And what we're going to do is, what we did is we cleansed the ear so that now your eardrum is free to move around and have no problem with the sound bouncing in the ear and reflecting outward. Isn't that awesome? Yeah, and you can listen to whatever music you want now. Just turn the volume down, okay? Again, I did notice you have that anime t-shirt, so just make sure that you're listening to your anime music a little bit lower, okay? So, continuing on with the medical exam, what I'm going to do is I'm going to give you just a quick, it's called a smell test. It's testing your olfactory sensory nerves. I learned that on my last course. Kind of a professional. And what we're going to be doing is just testing to see if you can smell very generic scents. Okay? Do you feel like you've had loss of sense of smell recently? Or have you had that in the past? Okay, well, we're going to test that today. And again, these are a bit unconventional. These are actually my own custom essential oils that I've made from perfumes. And I want you to let me know what is like what. So if you smell something that smells like, perhaps it smells like peppermint, just say that smells like mint. You get it? Good. I think you'll do amazing. So this first one I have here is a pretty unique one. Could you let me know what that smells like? Oh, you almost got that right away. So that smells a bit like mint. Perfect. Good. So this one actually is mint and bergamot. It's a perfume that is so nice. All you have to do is apply it and you'll like feel so luxurious for the day. Yeah, are you someone who wears a lot of like perfume? Yeah, I could tell that you maybe don't. Yeah. So we're gonna try another one now. And this one is super unique, but it does have a very generic smell that most people get. I don't know, maybe you will, maybe you will. It's a bit of a luxurious smell. Yeah, a bit like candy, you say, a bit like fruit. What are we thinking? Okay, this one smells a bit like candy. Any idea what it is? Okay, so this one is actually cotton candy, and it actually has a mix of jasmine in it, and it is the base smell for a very expensive perfume. Not that you would really know if you do know, but it's a super good one, and you identified the candy part, so I'm gonna write that down. Amazing and flawless. Okay, on to the next one. This one is, ooh, this one smells so nice. So, what does this one smell like? Okay, you got that one almost immediately. This one smells like citrus, kind of like an orange or a lemon. Very good. So this one is orange blossom, and this one smells exactly like the fruit. And this one is made directly from orange extract. So you are doing flawlessly. I'm gonna write that down, and we have one last one. So I'm gonna just speed this up a little bit because I do have to go see my friends. I mean, like honestly, I love sitting here. I love sitting here and taking care of you, but like I do have, you know, things I can do with my time. You know, yeah. You get it. You get it. So, okay, and here's the last one. And this one is a very expensive perfume, but it does have a very distinct note in it. Yes, what does this one smell like? It smells like a spa. Exactly. And what is that? That one is lavender. You got it. So this one is a lavender-based orchid perfume. This one's perfect for the springtime. If you're interested, would you like a little bit? You might need a little bit of perfume. No, I mean that politely. Let's add a little bit. Can you just sit still? Perfect. And it looks like now you smell a bit like lavender and orchid, and that's gorgeous. That means that your nose is working properly. I'm gonna write that down. And last but not least, what I'm going to be doing is a muscular test. We're going to be testing your muscles to make sure that they are doing well. Okay, so do you notice that sometimes if you do have a bit of an upset stomach or you have a bit of a headache, that you feel like you're not able to perform your best? Yes, well, those things can actually distract you from feeling and having you work your best, and that's actually the truth. And do you feel like see if your reflexes are affected by that, okay? Fabulous. So I'm gonna first test your face, okay? And what we're gonna do is I'm going to put my hand in front of it and just carefully tap on your forehead, next to your sinuses, and on your chin. And I'm looking for reactions from parts of your face. We're gonna then move to your shoulders, your hands, and your legs, and then you're ready to go. Yeah, doesn't that sound awesome? It totally is. So first, let's see your face. Okay. So I'm gonna test in 3, 2, 1, 3, 2, 1, 3, 2, 1. And reflex was great with your eyes. That was perfect. Onto your sinuses. 3, 2, 1, 3, 2, 1, 3, 2, 1. Marvelous on the other side. 3, 2, 1, 3, 2, 1, 3, 2, 1. Okay, and on your chin. 3, 2, 1, 3, 2, 1, 3, 2, 1. Now I'm gonna test your shoulders. Okay, relax. I know how you like to raise your shoulders, but I need you to relax. Good. Reflex was good, and reflex was good. Now I'm gonna test your arms right here. If you can give me your hand. Good, and test the reflex. Flawless, that was good. And the other hand, flawless, that was fabulous, amazing. You're doing great. You're doing great. You're doing amazing. Now your knees. I'm just gonna ask you, please not to flail your knees. I do know that sometimes I can be a bit funny. Okay, I've been a bit professional, but please try not to flail your knees everywhere, okay? Good. So, 3, 2, 1. Good reflex, 3, 2, 1. Good reflex, amazing. So I'm gonna write that down. And what I'm gonna write down for you is that we increase fiber in your diet. You know why? I'm gonna ask that you take some more time to relax for yourself because you deserve it. Thank you so much for coming to the doctor's clinic today. Again, I am Dr. Unprofessional. And if you can't tell, I am a super good professional at my job. Thank you so much for coming on by today. And cheers. I hope to see you feeling amazing again because you deserve to feel 1,200% better. Good. Cheers. But seriously though, you need to skedaddle a little bit faster because I do need to go catch up with my friends. So, make haste. Make haste.